Top 25 Nursing Antibiotics NCLEX Interview Questions and Answers. Preparing for the NCLEX requires a solid understanding of antibiotics and their safe administration in nursing practice. Nurses must know how antibiotics work when they are prescribed and how to monitor patients for side effects and effectiveness. The following 25 Nursing Antibiotics NCLEX Interview Questions and Answers will help nursing students and professionals strengthen their knowledge of antibiotic therapy, patient education, and infection control for clinical practice and exam preparation. 1. What are antibiotics and why are they used in nursing care? Antibiotics are medications used to treat bacterial infections by killing bacteria or preventing their growth. In nursing practice, antibiotics are prescribed to manage infections such as pneumonia, urinary tract infections, and wound infections. Nurses play a crucial role in administering antibiotics correctly, monitoring patient responses, and educating patients about proper use. It is important for nurses to ensure the patient completes the full course of antibiotics to prevent antibiotic resistance. Nurses must also check for allergies before administration and monitor for side effects such as diarrhea, rash, or gastrointestinal discomfort during treatment. 2. What is antibiotic resistance and why is it a concern? Antibiotic resistance occurs when bacteria adapt and become resistant to the effects of antibiotics that once killed them. This makes infections harder to treat and increases the risk of complications. In nursing care, antibiotic resistance is a major concern because it can lead to longer hospital stays, increased healthcare costs, and higher mortality rates. Nurses help prevent resistance by administering antibiotics exactly as prescribed, educating patients not to misuse antibiotics, and promoting infection control practices such as proper hand hygiene. Encouraging patients to complete their full antibiotic course is essential to prevent resistant bacteria from developing. 3. What should a nurse assess before administering an antibiotic? Before administering an antibiotic, a nurse should assess the patient for allergies, particularly to medications such as penicillin or sulfa drugs. The nurse should review the patient's medical history, current medications, and laboratory results, including culture and sensitivity tests. Assessing kidney and liver function is also important because these organs help process many antibiotics. The nurse should check vital signs and assess symptoms of infection. Proper identification of the patient and verification of the medication order are also necessary. These assessments help ensure safe administration and reduce the risk of adverse reactions or ineffective treatment. 4. What is the importance of culture and sensitivity testing? Culture and sensitivity testing helps identify the specific bacteria causing an infection and determines which antibiotic will be most effective in treating it. In nursing practice, this test ensures targeted therapy rather than using broad-spectrum antibiotics unnecessarily. Nurses are responsible for collecting specimens properly before antibiotic therapy begins to avoid inaccurate results. Once the results are available, healthcare providers can adjust antibiotic therapy if needed. This process improves treatment effectiveness, reduces unnecessary antibiotic use, and helps prevent antibiotic resistance. Accurate specimen collection and timely communication of results are key responsibilities for nurses in patient care. 5. What are broad-spectrum antibiotics? Broad-spectrum antibiotics are medications that work against a wide range of bacteria, including both gram-positive and gram-negative organisms. They are often used when the exact bacteria causing an infection is unknown. In nursing care, these antibiotics may be prescribed initially while waiting for culture and sensitivity results. Once the specific bacteria are identified, the healthcare provider may switch to a narrow-spectrum antibiotic. Nurses should monitor patients carefully when broad-spectrum antibiotics are used because they may disrupt normal body flora and increase the risk of secondary infections, such as fungal infections or antibiotic-associated diarrhea. 6. What are narrow-spectrum antibiotics? Narrow-spectrum antibiotics target specific types of bacteria rather than a wide range. They are often used after laboratory tests identify the exact bacteria responsible for an infection. Using narrow-spectrum antibiotics helps reduce damage to normal body flora and lowers the risk of antibiotic resistance. In nursing practice, these medications are preferred when the causative organism is known. Nurses should monitor the patient's response to treatment and watch for possible side effects. Educating patients about taking the medication exactly as prescribed is also important to ensure effective treatment and prevent recurrence of infection. 7. What are common side effects of antibiotics? Common side effects of antibiotics include nausea, vomiting, diarrhea, stomach pain, and mild skin rash. Some patients may also develop yeast infections because antibiotics can disturb normal bacterial balance in the body. Nurses must monitor patients closely for these reactions and report severe symptoms to the healthcare provider. In some cases, antibiotics can cause allergic reactions, which may include itching, swelling, or difficulty breathing. Educating patients about possible side effects helps them recognize symptoms early. Proper hydration, taking medications with food if recommended, and completing the full course can help manage mild side effects. 8. What is a serious allergic reaction to antibiotics? A serious allergic reaction to antibiotics is known as anaphylaxis, which is a life-threatening medical emergency. Symptoms may include difficulty breathing, swelling of the face or throat, rapid heartbeat, severe rash, and low blood pressure. In nursing practice, recognizing these signs quickly is critical. If anaphylaxis occurs, the nurse must stop the medication immediately and notify the healthcare team. Emergency treatment often includes epinephrine, oxygen, and intravenous fluids. Nurses must always assess patient allergy history before giving antibiotics and monitor the patient during and after administration to ensure prompt intervention if a severe reaction occurs. 9. Why is it important for patients to complete their antibiotic course? Completing the full course of antibiotics is important to ensure that all bacteria causing the infection are eliminated. If patients stop taking antibiotics too early, some bacteria may survive and multiply, leading to recurrence of infection. Additionally, incomplete treatment contributes to antibiotic resistance, making future infections harder to treat. Nurses play a key role in educating patients about the importance of finishing their medication, even if they start feeling better. Providing clear instructions and emphasizing adherence helps improve treatment outcomes and reduces the risk of complications or resistant bacterial infections. 10. What is superinfection? A superinfection occurs when antibiotics disrupt the normal balance of microorganisms in the body, allowing harmful organisms to overgrow. This often results in infections, such as oral thrush or vaginal yeast infections. In nursing practice, monitoring patients receiving long-term or broad-spectrum antibiotics is important because they are at higher risk for superinfections. Symptoms may include white patches in mouth, itching, unusual discharge, or persistent diarrhea. Nurses should report these symptoms to the healthcare provider promptly. Educating patients about maintaining good hygiene and recognizing symptoms early can help prevent complications associated with superinfections. 11. What are the 5 rights of medication administration? The 5 rights of medication administration are essential safety principles in nursing. They include the right patient, right medication, right dose, right route, and right time. When administering antibiotics, nurses must verify each of these rights to prevent medication errors. This process involves checking the patient's identification, reviewing the physician's order, and confirming the correct dosage and route of administration. Proper documentation is also important. Following the 5 rights ensures safe and effective treatment, reduces the risk of harm to patients, and promotes high-quality nursing care in clinical settings. 12. What nursing interventions are important during 4 antibiotic therapy? During 4 antibiotic therapy, nurses must monitor the 4 site for signs of redness, swelling, or infiltration, checking the infusion rate, and ensuring the medication is administered according to the prescribed schedule is also essential. Nurses should observe the patient for allergic reactions or side effects during the infusion. Maintaining proper aseptic technique helps prevent infections. Additionally, nurses should monitor laboratory results and assess the patient's clinical response to treatment. Patient education about reporting unusual symptoms is also important. These interventions ensure safe administration and help detect complications early. 13. What is the role of nurses in preventing antibiotic resistance? Nurses play a vital role in preventing antibiotic resistance by ensuring antibiotics are used appropriately. They administer medications exactly as prescribed and educate patients about not skipping doses or stopping treatment early. Nurses also promote infection prevention strategies, such as proper hand hygiene and isolation precautions when necessary. Monitoring patients for effectiveness of therapy and reporting concerns to healthcare providers supports responsible antibiotic use. By encouraging patients to avoid using leftover antibiotics or sharing medications, nurses help reduce misuse. These actions collectively help slow the development of antibiotic-resistant bacteria. 14. What patient education should be provided when taking antibiotics? Patient education is a key nursing responsibility when antibiotics are prescribed. Nurses should instruct patients to take the medication exactly as directed and complete the full course. Patients should be advised not to skip doses and to take the medication at evenly spaced intervals. Some antibiotics should be taken with food, while others should be taken on an empty stomach. Nurses should also inform patients about potential side effects and when to seek medical attention. Avoiding alcohol or certain medications may also be necessary depending on the antibiotic prescribed. 15. What is the difference between bactericidal and bacteriostatic antibiotics? Bactericidal antibiotics kill bacteria directly, while bacteriostatic antibiotics stop bacteria from multiplying. Bactericidal drugs are often used for severe infections where rapid bacterial elimination is needed. Bacteriostatic antibiotics allow the body's immune system to destroy the bacteria once their growth is halted. Nurses should understand this difference because it can affect treatment decisions and patient outcomes. Monitoring the patient's response to therapy is essential regardless of the antibiotic type. Both categories play important roles in infection management and must be administered according to the healthcare provider's instructions. 16. Why should some antibiotics not be taken with dairy products? Certain antibiotics, such as tetracyclines and fluoroquinolones, can bind with calcium found in dairy products. This interaction reduces the absorption of the medication in the digestive system, making it less effective in treating infections. Nurses must educate patients about avoiding milk, cheese, or yogurt when taking these antibiotics. It is usually recommended to separate the antibiotic dose from dairy consumption by several hours. Providing clear instructions ensures that the medication works properly. Understanding food-drug interactions helps nurses improve treatment effectiveness and prevent reduced antibiotic activity. 17. What laboratory tests are monitored during antibiotic therapy? During antibiotic therapy, nurses may monitor laboratory tests such as complete blood count, CBC, kidney function tests, and liver function tests. These tests help determine whether the infection is improving and whether the medication is affecting the patient's organs. Some antibiotics can be toxic to the kidneys or liver if used for long periods. Nurses should also monitor culture and sensitivity results to ensure the prescribed antibiotic is effective against the bacteria causing the infection. Careful monitoring allows healthcare providers to adjust treatment if necessary and helps ensure patient safety. 18. What are aminoglycoside antibiotics and what precautions are needed? Aminoglycoside antibiotics are powerful medications used to treat serious bacterial infections, especially those caused by gram-negative bacteria. Examples include gentamicin and amikacin. These drugs can be effective but may cause side effects such as kidney damage or hearing loss. Nurses must monitor kidney function tests and assess patients for signs of hearing changes, dizziness, or decreased urine output. Ensuring correct dosage and monitoring blood drug levels are also important. Adequate hydration may be recommended to reduce toxicity risk. Careful monitoring helps ensure safe and effective use of aminoglycoside antibiotics. 19. What are penicillin antibiotics? Penicillin antibiotics are among the most commonly used antibiotics for treating bacterial infections, such as respiratory infections, skin infections, and throat infections. They work by interfering with the bacteria cell wall, causing the bacteria to die. While penicillin is effective, some patients may have allergies to it. Nurses must always assess allergy history before administration. Symptoms of penicillin allergy may include rash, itching, swelling, or difficulty breathing. If a patient reports a previous allergic reaction, the healthcare provider should be notified immediately so an alternative antibiotic can be prescribed. 20. What is the nursing role when a patient experiences antibiotic side effects? When a patient experiences antibiotic side effects, nurses must first assess the severity of the symptoms. Mild effects such as nausea may only require supportive care or patient reassurance. However, severe symptoms like persistent diarrhea, severe rash, or breathing difficulty require immediate medical attention. Nurses should report these symptoms to the healthcare provider and document the patient's condition carefully. Patient education is also important so individuals know when to seek help. Prompt recognition and appropriate response to side effects help prevent complications and ensure safe antibiotic therapy. 21. What is Clostridioides difficile infection related to antibiotics? Clostridioides difficile infection, often called C. diff, is a bacterial infection that can occur after antibiotic use. Antibiotics can disrupt the normal bacteria in the intestines, allowing C. diff to grow excessively. Symptoms include severe diarrhea, abdominal pain, fever, and dehydration. Nurses must recognize these symptoms early and report them promptly. Infection control measures, such as proper hand hygiene and isolation precautions, are important to prevent spread. Treatment usually involves stopping the responsible antibiotic and starting specific therapy. Monitoring hydration and patient condition is essential in managing this infection. 22. Why should nurses monitor kidney function during antibiotic therapy? Many antibiotics are eliminated from the body through the kidneys. If kidney function is impaired, the medication may accumulate in the body and cause toxicity. Nurses must monitor kidney function tests, such as blood urea nitrogen, BUN, and creatinine levels during treatment. Observing urine output and signs of kidney problems, such as swelling or decreased urination, is also important. Early detection of kidney issues allows healthcare providers to adjust the antibiotic dosage or change medications if needed. Monitoring kidney health ensures safe antibiotic use and helps prevent serious complications. 23. What are common routes of antibiotic administration? Antibiotics can be administered through several routes, depending on the severity of the infection and the patient's condition. The most common routes include oral, intravenous for intramuscular, IM, and topical. Oral antibiotics are commonly used for mild to moderate infections, while 4 antibiotics are often used in hospitals for severe infections. Nurses must ensure correct administration technique for each route. Monitoring the patient for side effects and therapeutic response is also essential. Understanding different administration routes allows nurses to provide safe and effective antibiotic therapy. 24. What is antibiotic stewardship? Antibiotic stewardship refers to coordinated efforts in healthcare to promote the responsible use of antibiotics. The goal is to ensure patients receive the right antibiotic at the right dose for the right duration. This approach helps improve patient outcomes while reducing antibiotic resistance. Nurses play a key role by administering medications correctly, monitoring effectiveness, and educating patients about proper antibiotic use. Participation in infection control practices also supports stewardship programs. Responsible antibiotic management helps preserve the effectiveness of these important medications for future generations. 25. How do nurses evaluate the effectiveness of antibiotic therapy? Nurses evaluate the effectiveness of antibiotic therapy by monitoring the patient's symptoms and overall clinical condition. Improvement may include reduced fever, decreased pain, healing of infected wounds, and improved laboratory results. Nurses should also review culture reports and observe for signs that the infection is resolving. If symptoms worsen or fail to improve, the healthcare provider should be notified. Accurate documentation and regular patient assessment are important. Evaluating treatment effectiveness helps ensure that the chosen antibiotic is working properly and allows timely adjustments to the care plan if necessary. Understanding antibiotics is an essential part of nursing education and NCLEX preparation. Nurses must be knowledgeable about antibiotic types, administration methods, side effects, and patient education to ensure safe and effective treatment. These 25 Nursing Antibiotics NCLEX interview questions and answers provide a helpful review of key concepts for nursing students and professionals. Mastering these topics will improve clinical decision-making, enhance patient safety, and support success in the NCLEX examination and real-world nursing practice.